I'm a junior faculty member at Johns Hopkins University.
And I'm Ryan Demmer. I'm an associate professor in the Division of Epidemiology and Community Health at the University of Minnesota.
And we just wrapped up a great session at the Cardiometabolic Health and Disease session with 5 great speakers.
In the first session, we heard from Dr. Rooney, who looked at neighborhood-level particulate matter and forms of air pollution and its relation to cardiometabolic outcomes and disease, and saw some striking patterns in which people living in neighborhoods with really high levels of pollution also experience much higher levels of cardiometabolic disease. That opens the possibility for various interventions in the future to try and clean the air in neighborhoods who are experiencing high levels of cardiovascular disease burden.
And in the second talk, we heard from Shireen Mukhalid on prevalence of cardiovascular multimorbidity in the Bogalusa Heart Study. And this is a study in rural Louisiana. And she documented a really high burden of cardiovascular multimorbidity in this population, particularly in this rural setting. And the most common conditions were dyslipidemia, hypertension, and diabetes, consistent with the research we know. So this really highlighted an opportunity for interventions in rural settings.
In the next talk, we heard from Dr. Singh, who looked at trajectories of insulin resistance over time, predicting cardiovascular outcomes. And it really very nicely extended what we know about insulin resistance as a risk factor for cardiometabolic disease. In this particular case, they eliminated people who developed diabetes or had diabetes at baseline. So they were able to show that people with high levels of insulin resistance went on to increase cardiovascular disease event rates, even though they didn't go on to develop diabetes. So it, again, opens new avenues for different populations in which more could be done from an interventional point of view in the future.
Then in the next talk, we heard from Ho-Kyu Lee from Korea, and he talked about a cumulative score of an ideal cardiovascular health in young age, which is really important. There's not a lot of data on cardiovascular health really early, and this is a big opportunity for preventative interventions to help improve cardiovascular health in midlife. And he had this really cool cumulative exposure based on multiple measurements, not just based on one single baseline.
And in our final presentation, we heard from Dr. Alamiwak, who looked at BMI variability in over 1 million people over time and saw that variability in this metric of adiposity accumulation was very predictive of adverse cardiovascular outcomes in the future as well. And again, it sort of highlights things we already know about the disadvantageous nature of excess adipose tissue accumulation, but it adds a new dimension to it by looking at variability and might be a way to further refine risk scores and identify people who are eligible for benefits related to reduction in adiposity.
Yeah, it was a great session, and it was a pleasure moderating with you.
Yeah, it was really enjoyable, great science, and a pleasure moderating with you, Mary.
Thank you.